Mastercard Foundation has been working in Africa for well over a decade, and exactly as you said, to advance education, financial inclusion, really improve livelihoods of young people. But when the pandemic hit last year, we had to pivot like everyone else. And so we also responded. And the first part of that response was to enable frontline workers to have what they needed. But the core of our work went into ensuring learners, students continued to learn largely through digital means. And we helped sustain thousands upon thousands of micro and small businesses. But as the pandemic went on, it became clearer that it's so difficult for economies to reopen, for countries to begin that recovery, unless there was also a massive push behind vaccinations. Now, last year, we began our partnership with the Africa CDC with a $14 million contribution. And at that time, we didn't have vaccines, but the focus was on tests, training healthcare workers, getting PPEs, and helping set up labs and sentinel surveillance, which is basically an understanding of how the virus is moving across the continent. That partnership was very, very effective. And as this pandemic drew on, we started to think about what else, how else could we make an impact? And so the Africa CDC, once again, was a natural partner.
The Africa CDC has been pretty vocal, calling on governments and the private sector and others to try to help expand vaccine access. At this point in the pandemic, what would be your message to the international community when it comes to potentially distributing some of their own doses to countries in need?
That's a great question, and it's actually a timely question because the G7 are convening in the UK this week. And I would say there are four messages. One, for the countries which have an adequate supply or more than adequate supply of vaccine to really consider reallocating that vaccine to developing countries, particularly to Africa. The second is I would really urge these leaders to step behind delivery. That's where there's a huge need in terms of the logistics of getting vaccines into arms. Huge need. Third, many of the countries of the G7 are in a unique position to really invest in the long term, really make systemic investments. And one of the systemic investments has to be in manufacturing on the continent. And finally, I'd say, because we always look to our institutions in time of crisis, the G7 can also play a key role in building, strengthening, augmenting public health institutions.
The Africa CDC Director, Dr. John Nkengasong, explained what the partnership means for the continent.
This is a historic partnership for the Africa CDC and African Union. And of course, for the people of Africa, clearly, because we are in the middle of a pandemic, a crisis that we have never seen since independence in the 1960s. We've never been threatened this way by a disease, a deadly disease that is costing lives and costing economies. So as you heard in the announcement, this is truly designed to make sure that we save lives and save economies. We believe that and believe strongly that the pathway for us to resume our economies and continue to save lives is towards vaccination, that we need to vaccinate the continent with three principles. It has to be fair allocation of vaccines. They have to be delivered in a timely fashion, and they have to be done at scale. That is the only way we are going to continue to save lives and save economies.
What are the main obstacles when it comes to the vaccination rollout?
There are two major barriers to vaccination rollout in Africa. First of all, is having access, what I call a predictable access to vaccines. As you know, many developed countries acquired excess vaccines than they need. And we are saying that we are in this battle together. As humanity, they have to at least release those vaccines that they are sitting on in a timely fashion so that we can, as a people sharing the same planet, vaccinate at speed and at scale. I think that is one. The second thing is the logistics of vaccination. That is vaccination proper, putting the needles into the arms. And we have to look at several parameters, including behavioral issues. We have to work with the communities in very deliberately so that we earn their trust and listen to them and not just dismiss their concerns and fears and that characterize their behavior towards vaccines. And then, of course, countries have to show leadership, and we have to build appropriate partnerships with countries so that they can roll out vaccinations to reach even the hardest to reach area of any country. That is the only way we are going to achieve our target of immunizing at least 60% of our population by the end of 2022.
What is your message for governments around the world, particularly in advanced economies that do at this point hold extra doses?
My message to them is, has always been that we should be mindful of history, that you truly want to be on the right side of history when the history of this pandemic is written. And it is clear that history will remember those who did the right thing and did it quickly for us to come out from this pandemic. As we've all said, no one is safe until everybody is safe. As the G7 leaders made, my message to them is twofold. One is release those excess doses of vaccines in a timely fashion, work with Africa CDC, African Union, and other partners to support member states to roll out the vaccination quickly. Second is that let history not repeat itself. We have the ability and capacity to strengthen vaccine manufacturing sites across Africa and the rest of the world so that we begin to develop a different paradigm in the ability to set up a health security apparatus where we regionalize and decentralize our vaccine production, also diagnostic capabilities, so that next time we are faced with such a pandemic, we do not scramble the way we scrambled and struggle with this pandemic.